If you've been dealing with joint pain, stiffness or unexplained symptoms and wondering whether you need to see a rheumatologist, this video is for you. Many people assume their symptoms are just wear and tear or part of getting older, but in some cases delaying assessment can lead to long-term joint damage that could have been prevented with early treatment. I'm Dr. Naveen Bhadoria, consultant rheumatologist at Rheumatology London, and in this video I'll take you through 5 key warning signs that mean you should consider seeing a specialist. Let's start with the first and one of the most important. The first warning sign is joint pain lasting more than 6 weeks. Short-term aches are very common, but if your joint pain is persistent, not improving, or gradually worsening over several weeks, that's something that needs further assessment. Chronic joint pain can be a sign of inflammatory arthritis such as rheumatoid arthritis or psoriatic arthritis. The key point is persistence. If it's ongoing, don't ignore it. The second warning sign is morning stiffness lasting more than 30 minutes. This is a really useful way to distinguish different types of joint problems. If stiffness eases quickly within a few minutes, that's more typical of wear and tear conditions like osteoarthritis. But if you wake up feeling significantly stiff for 30 minutes or longer, that raises concern for inflammatory arthritis. Patients often describe needing time to get going in the morning, and this is a classic sign we look out for. The third warning sign is joint swelling. If you notice swelling in your joints, especially in the hands, wrists, knees or feet, that should always be assessed. Sometimes it's obvious, but other times it can feel like tightness or reduced movement. Swelling indicates inflammation in the joint, and if left untreated, this can lead to damage over time. Early treatment makes a big difference. The fourth warning sign is unexpected fatigue or feeling unwell. This is often overlooked but very important. If you're experiencing ongoing fatigue, low energy or a general sense of feeling unwell, especially alongside joint symptoms, it could point towards an underlying autoimmune condition. Some people also experience low-grade fevers or a general feeling that something isn't quite right. The fifth warning sign is a family history of autoimmune disease. If close family members have conditions such as rheumatoid arthritis, lupus, or psoriatic arthritis, your risk may be higher. So if you develop symptoms in that context, it's even more important to get checked early. Now, there are also a few additional signs worth mentioning. If you have back pain that improves with movement but is worse at rest, particularly at night, that could suggest inflammatory back pain. If your fingers change color in the cold, turning white or blue, that may indicate Raynaud's phenomenon. And if you have psoriasis along with joint pain, that raises the possibility of psoriatic arthritis. So what should you do if you recognize some of these symptoms? The most important thing is not to ignore them. Early diagnosis is absolutely key in rheumatology. Starting treatment early can prevent long-term damage and significantly improve outcomes. At Rheumatology London, we focus on rapid access, detailed assessment, and clear treatment plans. During your consultation, we take a thorough history, examine your joints, and arrange appropriate investigations if needed, such as blood tests or imaging. The aim is to give you clarity and a clear plan moving forward. To summarize, you should consider seeing a rheumatologist if you have persistent joint pain lasting more than 6 weeks, morning stiffness lasting more than 30 minutes, joint swelling, unexplained fatigue or systemic symptoms, or a family history of autoimmune disease. And if any of these apply to you, it's worth getting a specialist opinion sooner rather than later. If you found this video helpful, make sure to subscribe for more content on joint health and autoimmune disease. And if you're concerned about your symptoms and would like a specialist assessment, I see patients at Rheumatology London. Details are in the description below. Thank you for watching.